Gynecomastia is treated two ways, either with liposuction alone, with excision cutting out of the gynecomastia tissue alone, or a combination of both. With liposuction, there are usually 2 or 3 very small incisions, often one on the areola, one right underneath the chest, and maybe another one up here. And we like to make multiple incisions because if you're sucking from the same place, you're kind of repeating what you're doing, and you're not sculpting in 3 dimensions. So by making multiple incisions, you can sculpt around and get a better overall look. Now these incisions are small. They're about 1/8 of an inch long, and they heal up very well. If a guy has a hairy chest, it's great. You'll never see them. But if a guy shaves his chest or has no hair, there will be a little mark. Now, to conceal that tiny little mark, I don't make them symmetrically. In other words, if you see scar, scar, the eye knows something's up. But if one's here and one's down over there, then the eye, the person looking at you, won't see it. Again, with time they fade, but that's what you get from liposuction. If you need to have excision, then a little incision is made just around the areola, usually about 1 inch worth of the perimeter of the areola. That usually heals very well because there's obviously a natural border between the darker and more pigmented areola and the lighter skin around it. Certainly, if there's any hair in that area, it obliterates it, but those are your scars. If you need excision, a little one around the areola. If you need liposuction, 2, maybe 3, usually just 2 incisions, usually under and towards the outer part of the chest.